All right, we're going to get started. People trickle in because of traffic, no big deal. So my name is Dr. John Meinert, and I am founder, runner, and lackey of the Bioethics Lecture Series. And I originally founded it because when I came to Our Lady of the Lake at the time, FranU now, there were no academic lectures on campus, which seemed odd to me given that we were a university. So I remember talking to some people about this, and they were like, well, why don't you just go do that? So I was like, well, I guess I will. So happily, they helped me with the money. So the purpose of the lecture series is twofold. It's one, kind of increase understanding of ethics and bioethical issues across campus and in the community, but also second, to present a kind of cogent presentation of the Catholic view on these and a defense of it. So in light of that, I'm very excited to introduce Dr. Jeffrey Bishop tonight, who is a joint MD, PhD. So that tells you something about him. Exactly. He's the director for the Center for Healthcare Ethics at St. Louis University. So if you know anything about that program there, it supplies a lot of ethicists for Catholic hospitals across the nation. He is also has a joint appointment in the Theology and Philosophy department there. His first book, which I was actually just listening to a lecture this afternoon by an MD who was clearly poaching all of your stuff. But
He's a friend of mine. He's a friend of mine, so he's allowed.
It's called The Anticipatory Corpse, looking at our practices surrounding death and dying. He's also a prolific writer. You can Google him, but don't look at his website because he doesn't update it. So without further ado, Dr. Jeffrey Bishop.
Thank you. Thank you. I'm a native Texan, and these people are behind the pillar there, and I'm a little paranoid. I'm wondering what they're doing over there. So, well, thanks for having me. I'm going to try to make this as interactive as possible, and he wants me to stay in the frame too. So I'll try to make this as interactive as possible. As my father says, my father has several. I grew up in rural Texas, and my father has several rural witticisms, I guess, and one of them is a broken clock is right at least twice a day, and the other is even a blind hog comes across an acorn every now and then. And so that's this next. Oh, it's not up here yet. How do we get it up here?
I probably just shut off because we waited so long.
Or does it? Is it there?
No, you gotta drag it down.
Oh yes, front
Ah, there it is. There we go. So this next slide is proof that even a blind hog can at least get it right once in a while. So I got to meet Pope Francis, which was, I have to say, one of the coolest things. My life is kind of complete now. So I when he walked into the room, it was a pretty powerful experience. It's just kind of choked up just realizing that, here is someone who traces his lineage all the way back to Peter. And the other thing about it was I was going to speak to him in Spanish and say to him, I'm from Texas, and I was so overwhelmed. Like, hi. That's all I could get out in English. So it was pretty cool. So what I'm going to do today is I'm going to compare and contrast some problems that I see in contemporary practices, compare and contrast those with an older way of thinking about death, thinking about dying. I'm going to go through and do what I call a statecraft of killing. And I'm going to try to explain why this is problematic on many levels, not just because it is intrinsically evil, but it has to do with power and our understanding and uses of power in medicine. We'll look carefully at the Oregon Death with Dignity Act, and many of the other acts around the United States are kind of modeled on the Oregon Death with Dignity Act. In addition to that, I'm going to talk about how medical procedures and practices kind of end up framing the option for euthanasia, or the option for physician aid in dying, as it is now called by its proponents, how it is problematic. And I'm going to show how when our procedures and our policies become unmoored from a deeper ground, they often leave us unmoored, right? At sea, floating. Sometimes making probably problematic decisions. And then I'm going to tell you a little bit about ars moriendi, and then we're going to do something kind of like an ars moriendi. And so I'm going to be talking about the first half, and then I'm going to have you guys do some talking as well. Okay? All right. So the medical ethics began with theologians. Paul Ramsey was one of the leading medical ethicists. He was a Christian ethicist, a Methodist Christian ethicist. Joe Fletcher was an Anglican priest who started writing in bioethics and in medical ethics. Fletcher ends up abandoning his faith, renouncing his orders within the church, within the Episcopal Church, and essentially becomes an agnostic for the remainder of his life. And then Richard McCormick was a Catholic theologian, one of the leading Catholic theologians in bioethics. But then something happens. This is all going on in the 60s and 70s. Fletcher in the 60s, Ramsey in the late 60s and 70s, and then McCormick in the late 60s up until the early 80s even. Leading figures. And what happens is that theological reflection in bioethics sort of gets marginalized in about 1974 with the establishment of the, it's now called the President's Commission on Bioethics. At the time, it was called it was a long title, it was the National Commission on Ethics in Human Subjects Research. I mean, it was a really long title. It published something called the Belmont Report. And one of the leading people in the Belmont Report was a guy named Tom Beecham, and he goes by Beecham. And Beecham was, he wanted to try to move ethical reflection out of the theological zone and into a kind of what he called mid-level philosophical zone. Okay, and what he wanted to do was to avoid theory, to avoid metaphysics, and to try to get to say, well, what can we agree on regardless of our moral theory, and what can we agree on regardless of what we believe the ultimate purposes of life are. Okay, and so he and Jim Childress come up with these 4 principles, and these principles are like general rules, 30,000 feet up in the air, general rules. One of these rules is the principle of beneficence. In other words, do good. Okay? Non-maleficence. Don't do bad. Don't do harm. The other one is respect for persons. Actually, they changed it from respect for persons and to respect for autonomy. Okay? It shifts from being respect for persons to respect for autonomy. And fourth, justice. And by justice, they mean a kind of a balancing things out so that they're fair. Okay? And these principles should guide the procedures and the policies that we come up with. Okay? So these things are not grounded in anything terribly rich in terms of metaphysics. They tell us generally how to do the right thing, so they may not tell us how to do the good thing, okay? Because I'm going to show you that they're a little bit unmoored. Now, I'm going to be critical of procedures and policies. However, I also want to point out that Thomas Aquinas would not be so critical, maybe as critical as I'm going to be, right? Thomas believed that the law can be a moral teacher. That means principles and policies can be moral teachers. And I'm going to show you how that's possible, okay? So that's a good thing, all right? Procedures can inculcate habits. I'm going to show you how they do that sometimes. They inculcate habits in physicians and practitioners because they remind us to cover all of the material. Okay? And they help us to keep a record of patient wishes. So these things can be good things. So I'm going to look at some of the legal procedures. And we're going to look at how this plays itself out in the Oregon Death with Dignity Act. Okay? All right. So the Oregon Death with Dignity Act says to ensure that the patient is making an informed decision, inform the patient of A, a lawyer wrote it, his or her medical diagnosis, B, his or her prognosis, C, the potential risks associated with taking the medication to be prescribed, the lethal medications that the person's going to inject. They need to know the risks associated with that. D, the probable result of taking the medications that they will be prescribed. And E, the feasible alternatives, including, but not limited to, comfort care, hospice care, and pain control. Okay? All right, so that's the purpose of the law. And so the way this happens is the patient has to notify his or her physician that, in writing, that they would like to consider the option of taking the lethal medication. Okay? The physician then visits with the patient and looks at their medical diagnosis and confirms that diagnosis, determines if the patient is capable, has the capacity to act voluntarily, and if the physician thinks the person has a legitimate request, he has to refer the patient to a second physician who will go through the same sort of procedure. If there's any hint that the patient might be depressed or have a psychiatric disorder, then they are permitted to, and they are advised to, refer the patient to counseling if it's appropriate. Okay? All right. So 2 docs and possibly a psychiatrist or a psychological counselor will not only be assessing the patient about his capacity or her capacity to make this decision, but they will be confirming for the patient that this is in fact a rational response. So when a patient comes in and says, I'd like to consider this, and then you ask them all of the questions, and then they say, well, it sounds like this is a informed decision, and you are being rational, right? So when the doctor engages in doing this assessment, he or she's not just some sort of neutral observer, right? They're in a relationship with the patient. And in being in that relationship with the patient, there's a way in which you say something, the patient says something back. Or the patient interprets what you say, right? So not only is one physician potentially reaffirming for the patient that this is indeed a legitimate decision, a second physician does it as well. And if there's any question about whether the patient has any psychiatric disorder, then a psychiatrist will also make that determination. So while the procedure and the policy is meant to screen out anyone who might be making this decision for the wrong reasons, right? It winds up confirming that it is a rational choice. So procedures and policies are not neutral, okay? So what happens then is that the power that we have in medicine kind of gives a kind of blessing to the patient's desire to terminate his or her life. Okay? So the power vested in medicine, and we have a great deal of power, the power vested in medicine not only is the power of medicine, but because this is ensconced in law, it has the power of law behind it. So we have a confluence of powers. Institutionalized power. Doctors are licensed by the state, right? We're governed by the state. And so our power, at least in part, is not only in our knowledge, but it is in the power of the state to grant us licenses, right? But it also has the power of law as well. So So the state is both the arbiter of the law and, in a way, the arbiter of medicine as well. Okay? So these two very powerful institutions are reaffirming for the patient that this is a legitimate and rational choice. Okay? Let me say one more thing. A woman named Martha Minow, she's a jurisprudence scholar. She's a professor of law. Okay? And she wrote an article in 1997 that was entitled something like which law, which lie. Okay? And one of the things that she points out is that once you give the tool of physician-assisted death to the physician and put it in the little black bag, so to speak, all right? It's not just one more tool, right? It's not like, oh, we have this treatment A, treatment B, treatment C, and oh, physician-assisted suicide, okay? It's not like it's just one more option, because she says it actually reframes all options so that you have to reaffirm why it is that you have a terminal condition and you're not choosing death because it's a legitimate option sitting there, right? It fundamentally reframes all other options. It gives all other options a kind of context that then requires you to have to say why you are not choosing option D when you have all four of them sitting there. All right? In other words, at some point, you have to give reasons why I'm choosing A over D. So it's not just one more choice. It fundamentally reframes all other choices. Okay? All right. Now, procedures are created to inculcate habits. All right? The first time I ever did informed consent, I had to have the form right there, and I had to remember all the things for this procedure that I needed to cover, right? And that was a good thing because I was green and wet behind the ears, right? I needed to have some sort of procedure there to remind me how to do that. And then the second time I did it, and the third time I did it, and the fourth time I did it, and the fifth time. Eventually you get so good at it that you're able to know exactly what to cover. It encourages habits, okay? And that's a good thing. Procedures are created in order to assist and standardize interactions, right? This way, if I'm doing it, then the surgeon down the hall is doing it as well. And he or she is doing the same thing. That way we know that everybody's being treated the same. That's a good thing as well. Procedures are created to prevent error, right? It allows us to go through all of the other problems, right? And it makes you think about, this person in this context, given all of these other things, even though this is an option, it may not really be an option. Once you sit down and think about all the things that could go wrong, for instance, giving them anesthetic might be fine for the vast majority of patients, but in this patient who has heart disease, it may not be good. It may be harmful, right? So it forces you to kind of think through that and to prevent error. Procedures are created in a way to secure friendship in the absence of trust. Okay? So you don't know somebody, right? You don't know what they're, whether you trust them. But boy, they went through this with you. Okay? It tells you something about what's going on in your care. All right? So in a way, the procedure creates friendship in the absence of trust. If you knew your surgeon extremely well, right, it would be fine. They're a buddy of yours. You know they're going to do right by you, right? But in the absence of them being your buddy, the procedure sort of fills in the gap, all right? And sometimes the procedures fill in for the absence of character, right? Sometimes docs are human beings. They're flawed creatures, right? And they might skip it, but the nurse is going to look through the chart and say, you didn't get this form signed, all right? And it's going to make the doc go get it done, right? All right. All right. But these procedures become unmoored from anything substantive. They become just rules, right? Just rules. And if you don't know, every rule is aimed at some purpose, usually aimed at something we call good. But once it becomes just a rule, it becomes disassociated with the good thing that it's aimed at trying to achieve. Okay? And so if that piece of paper becomes just a box of things that you have to tick off and get the patient to sign, then it's become unmoored from the good it hopes to create, which is friendship, trust, and all of the other good benefits of going through this procedure, right? It becomes unmoored from the good. And it becomes unmoored from relationships, right? It would be nice if you knew your surgeon personally, right? Or your anesthesiologist personally. And so it can kind of come as a stand-in from the anesthesiologist to have to get to know you, right? It becomes a kind of a tool that promises friendship and intimacy, but then it never can deliver on it if the person isn't doing it for the good, right? They're just following the rule, all right? And if you're creating procedures to secure friendships in the absence of trust, and if you're creating procedures to act in the absence of character, perhaps we've already lost the game, right? So if these things are meant to fill in these gaps, and then they become just rules that we follow, that we don't even really know why or what they're aimed at, then we probably have already lost the game, right? If we have to rely on these tools, we probably have already lost the game. So what are these procedures built on? Individualism, the idea that I am my own man. It's a very Texas notion, right? Lone cowboy out there on the range, heading out to gather up the cattle, right? This idea that I stand alone in the world. That's part of the mythology of the United States, of America, of Texas certainly. It's part of the mythology, but it's not truth, right? All of us have all kinds of social relations. I can remember at the VA hospital getting a consent from a patient to do something, and the patient would, I'd go through it all, and I'd write, all of a piece of it, and I said, would you like us to proceed with this procedure? Sign here. And he looks up at me and he looks over to his wife and he says, honey, should I sign it? All right? Well, that's not individualism. That's not autonomy. That's actually, most of us live our lives that way. We want the advice and opinion of people we love and we care and we trust in, right? So the idea of these procedures is that you are going to make an isolated decision all alone and by yourself, okay? All right. In other words, proceduralism is not neutral then. It's already committed to one of the highest goods, which is this idea of autonomy and of self-determination, okay? So it's not neutral. And it carries with it what I would call a thick metaphysical moral content of Western secular ideals and of what's called liberalism. The idea that you should be free, liberalism and not the left wing. I don't mean left wing there, I mean political liberalism. There are conservative liberals, which is what the Republicans are, and there are liberal liberals. They're both philosophically liberals, okay? There are just certain things. They disagree over the things they think they need to be free from, okay? The Republicans think they need to be free from government on certain things, and the Democrats think they need to be free from government on other things, right? It's just they're fighting over what they need to be free from, free for, okay? So it inculcates the sense that I need to be free and alone to make my decisions. Now that sounds good to me as a Texan, but probably not good for me as a human, okay? So there's a disconnect there, I think, between the goods of persons and the good as imagined within liberalism, all right? All right. So these procedures are not neutral. And you've probably heard of this, and I should have defined this, the physician's orders for life-sustaining treatment, POLST, okay? I'm not sure, I should have looked up whether Louisiana is a pulsed state. I'm not sure if it is. It is, okay. And so this is what in the old days I would have called in Texas the out-of-hospital do not resuscitate order, okay? And so the idea is that we will have patients who have terminal conditions to complete these. Now, most of the time we define a terminal condition as 6 months or less prognosis of living, okay? Pulsed goes all the way out to a few years, okay? And this form, I should have said this up front. Let me go back. I'm sorry. I'm going to make you dizzy. Close your eyes. I'm going to go back to it. This is a pulsed form. Right, that first thing I had up there. Oh, goodness gracious, I'm sorry. I should have pointed this out. Don't you? The forms are so, this is a pulsed form right there, okay? Little boxes to tick to help you know what the patient wants, etc., okay? Hold on one second. I'm going to escape so I don't make you all dizzy. And I'm going to go to, all right. All right, so that's where I want to be right there. Sorry about that. Well, this thing doesn't want to move right. There we go. So what happens then is that the pulsed procedure, right? This is the big concern, is that the pulsed procedure will become allied with the euthanasia laws, okay? So that as part of your hospice intake, you'll be required to fill one of these out, okay? And I promise that at some point, someone is going to say on that form, do you want physician aid in dying? Okay? That's the way procedures and policies work. Once it becomes legal, all of the laws have to line up with each other. So the idea of the pulsed, which is a good idea, okay? We need things like that to know whether or not we want to begin resuscitation on a patient. But amongst the list of options will be, do you want physician aid? Do you want information about physician aid in dying? Okay? To me, that is my biggest concern, all right? Because then all of these powers line up in such a way that when you're offered the option, it's not just one more option. It fundamentally reframes all other options. All right. I won't say that again. All right. So, now, that's the concern. What I would say is that all of these state-sanctioned procedures and policies have become our practices, okay? Our practices around death. And I'm going to tell you about something known as the ars moriendi. You probably have heard of this. Do you know, who knows what the ars moriendi is? Ah. Okay, good. That's great. The ars moriendi, A-R-S, ars, art, moriendi in Latin means of dying. And it was a set of manuals that were given to people, and these came about in the 15th century after a particularly terrible plague in Europe. Okay? And these came about right around, shortly before, the plague came about shortly before the printing press comes into vogue. I mean, they're just starting to get the printing press, I think at 1450, something like that. But at this time, the plague has come, and the priests are dying too, and people are dying without spiritual counsel because priests are dying as well. And so they created the ars moriendi, which is a manual. And in the manual, there's usually, on the one hand, on the one side of the page, a list of prayers, a list of questions for self-examination, and a few words of Scripture for inspiration. And on the other is a person who is a drawing, a woodcutting drawing of a person who is dying. And there are usually angels and demons there, each one trying to capture the person's attention, the demons trying to lead them to despair so that they will die in sin, and the angels trying to give them encouragement. Okay? And so the idea was, we need people, because people are dying left and right, we need people to think carefully on their dying. Death has a way of focusing your attention on what matters, right? If I told you, if you found out today that you were going to die, you would probably say, you had a cancer and you were going to die, let's say. You probably would say, I'm not going to that lecture tonight, right? You would say, I'm going to go figure out who is important in my life and I'm going to go talk to them, right? This is what the Ars Moriendi was trying to do, to get people to think about their own mortality, right? To be prepared for their dying, okay? And so these manuals were set up, okay? Grounded in the practices of the church, grounded in the practices of religion. These were done not only by Roman Catholics. You can find Protestant versions of the Ars Moriendi from the 16th century onward, okay? You can find Lutheran versions, Zwinglian versions, pretty much any branch of the Reformation, you can find versions of this because they realized that this was very important for people, okay? And so what I'm trying to say is that here's one set of procedures, the Ars Moriendi, the art of dying, that comes from a spiritual tradition versus the modern secular version of the art of dying, which is completing these forms and going through these procedures, all of which I've been arguing kind of focus us on death, taking my own life as the best option out there, okay? The Ars Moriendi tried to get you to focus on what's most important, which is the spiritual dimension, right? It asks you to look at your moorings, the things that hold you to the ground, okay? All right, so the next section is, what are our moorings here, okay? And I love icons. There's a lot going on in icons. And so we're going to do, we don't have tables, so you're going to have to gather in a circle, and I'm going to have you, I want you to look at this icon as best you can and describe what you see in a small group, and then talk amongst yourselves about these questions. So get into small groups or people around you and I'll interrupt you, and we'll take about 4 or 5 minutes. All right. Let's sort of wrap it up here. All right, and I want anyone with a master's degree or a PhD in theology cannot say anything. They'll mess it up for us all. All right? All right. So what do you see, first of all? Describe what you see.
Well, it looks like angels are on the outside.
Yeah, there are angels there, exactly. So those are the angels that probably were calling to the shepherds to come and see the Christ child. Yep. What else? So the host of heaven is surrounding earth there. What else do you see? Okay, and you're talking about this part right here, the mountain?
Right.
Yeah, it kind of looks like a holy temple. Yeah. And what's this here?
What is what? What again?
Yeah, what is this black right here?
Is that the star?
No? Any thoughts? Just take some guesses. It's okay.
You know what it looks like?
Yeah.
I've seen a sonogram, like the womb.
Oh, yeah.
I wasn't supposed to.
Yeah, it's kind of like a womb. Actually, no, that's actually part of the tradition in Eastern Christianity, is that the sepulcher, the cave in which Christ is buried, is like a womb. Okay? And so in the tradition of Eastern Christianity, so Orthodox Christianity, Christ is born, the manger is in a cave. Okay? He's buried in the cave, and he's born in the cave. Okay? So in Eastern Christianity, the tradition is always to depict the birth of Christ with the cave in the background. Okay? And it is the temple. Okay? All right? And actually in Eastern Christianity, there are hymns to the Virgin Mary in which she is called the temple of Christ. Okay? She's called Theotokos, which in Greek means the God-bearer. Excuse me, God-bearer, the one who bears God. You see here is probably Anna and John the Baptist. And you've got the shepherds over here, and you've got the angels, of course, who have announced to the shepherds. Okay, let's go forward a little bit. All right. Now, here's a tradition. You know, do you ever wonder where we got the word hospital? We got the name hospital from the Benedictine monks and nuns. Okay? So they had attached to the monastery a hospitality room, essentially. Okay? Where the poor, the sick, the orphans, the widows, all of those the prisoners who've been released, all of those who Jesus mentions in Matthew 25 can stay. Okay? And it was at some points for the hospitality room for the poor was called the hospitalum pauperum. Okay? All right. So this is the tradition. We get the word hospitality. It's also the word that gives us the word hotel, hostel, and hospice. All of it stemming out of the chief virtue of giving hospitality to the poor, the sick, the suffering, the wounded. Okay? All right. What do you see here? This is an old icon. Some of the painting is gone. Okay, what do you see? Describe it. Okay? Yeah, so this is the River Jordan. Okay? You can't quite see it, but the dove is there. All right? John the Baptist is on the side, and this is not a good image. So, in a way, this chasm of the river, at least in this icon, it kind of almost looks like the chasm of the nativity as well, right? All right, so I want you to talk amongst yourselves about this icon. Describe what you see. Talk amongst yourselves for about 3 or 4 minutes. Okay, go ahead.
Right, Nick. Yeah, that makes right here.
All right. So what are your thoughts here?
Well, baptism is associated with death, burial, and resurrection.
Mm-hmm.
When you get baptized, it's like your old spirit is dying, and then when you getting washed up by the blood of Jesus, so when you coming up as a new being.
Mm-hmm.
And it says, the baptism says a lot about the way Christians live, because every day we have to renew ourselves.
Hmm.
So that's why we believe, that baptism is important, because you die as an old creature, but you live.
You're raised anew.
Yeah.
Yeah.
To be rebirthed.
That's right. That's right. So baptism, the imagery is of death and resurrection, or death and birth, right? That's exactly right. Insofar as we have been baptized into Christ, we have been baptized into His death, right? That's what Scripture says, right? All right. So in the church's iconography and in church art, you often will see things where birth and death are recognized. So we can still kind of see here the temple, right? The mountains kind of coming up over the chasm of the river, right? So it kind of reminds us of the temple of the body, all right? So what other rites and ceremonies and sacraments of the church remind us of death and resurrection? Communion, certainly. Okay, there's one of the sacraments. We've talked about 2 now. And can you think of others? The whole of the Mass, right? I'm sorry? Anointing of the sick. Holy unction. That's right. Right? You're sick unto death. They used to call it extreme unction, right? When they would do it the last rites, right? That's what they call it. We don't reserve it just for the last rites anymore. It's actually an important rite of the church. Okay? So yeah. So unction reminds us that we are frail beings, right? And we are anointed with the oil. Do you think others? Okay, so confession. I'm sorry, what did you say, man?
Oh, that's what I was going to say.
Confession?
No, I was just going to say, like,
The Easter liturgy?
in
Okay.
general.
Exactly. Just the whole shooting match with Easter. We're going to come to that in just a moment and a lot more. Confession, let me deal with confession here. So think about confession. What is going on there? You talk about admitting your frailties, right? It's sort of, so the sacrament of confession is about renewing your baptismal covenant, right? About reiterating what you believe about the person of Christ, right? So yeah, it's about remembering that I've died to my old self of sin and death, right? And now I'm a new creature, and I constantly have to be, we're all sinners. We all have to constantly reorient ourselves and to look back, okay? What else?
Marriage, actually.
Marriage, yeah. I didn't know how bad a person I was until I got married, right? My wife reminds me of my own failings, right? All the time. Things that I would just skip right over and go off, and other people would have let it happen, right? They wouldn't even say anything, but not your wife, right? That's her job as a minister in the marriage, right? In the sacrament of marriage, right? So sure, it's kind of a reminder that I need to die to myself and to live anew for Christ, right? Yeah, David.
Seems there's something else also going on which says something about the value of the human body, right? So in when we bury people, we clean the body, we anoint it, or whatever the case may be, which is actually the same thing that we do in baptism.
That's right.
So it says, all the sacraments involve created things, and those are valuable and good.
Very.
And bodies are good things.
Absolutely.
Right? So I think there's another part of that sacrament.
I'm glad you brought that up because that's exactly right. And if you notice, the sacraments are usually made up of stuff, right? Water, oil, bread, wine, touch, right? All of that, right? All of that, the physicality of the body is renewed through the Eucharist, right? When we eat the body and blood of Christ, we take on His resurrected body, right? We take on His resurrected body. All right? So it's all about the stuff of bodies. That's exactly right. And these icons kind of get us back to that. So if we covered all the sacraments, I can't remember if we'd covered them all.
Confirmation.
Oh, confirmation. Now think about that for a minute. Confirmation is you move from a childlike faith to an adult-like faith, right? It's that kind of transition point where I can no longer be a child here. I've got to start acting like an adult. I've got to let the child pass away, and I've got to start taking on an adult-like faith, right? So I think there's even death and resurrection there, all right? And what's the last one? We don't have anybody in this room that I see who has it. Holy orders, right? Holy orders says, I'm not just going to be a follower anymore. I'll have to be a leader, right? You have to transition. Every one of these sacraments mark in very physical ways, the laying on of the hands in holy orders, right? Very physical ways in which death and resurrection are always present in the sacraments of the church. Okay? Let's go on. All right. Which one is next? All right. Here's the icon of the burial of Christ. All right. So I want you to talk about this one amongst yourselves for a little bit. And then I want you to deal with those questions, okay? Go ahead. All right, so what do you see going on here? Okay, so we're aiming back here towards the chasm, right? Which we call the temple, the womb, right? So that's the cave in which he's going to be laid. Okay? So what else do you see?
Touching and rubbing the body.
Yeah. They took him down from the cross. They've taken him to the tomb. And they're there to wrap and wash and anoint the body. That's still a tradition that's in Judaism. So if you've had Jewish patients, you know, I had a friend who was Jewish and a physician, and you know, I mean, he told me he volunteered at his synagogue to do the washing of the body, and he says it's the most powerful thing he's ever done. And he just, you know, I mean, he's a doctor. He's presided over birth and death and all of it. The most powerful thing he did is the washing of the body. Right? The ritual washing of the body. So what do you think about our cultural rituals? Or do we have cultural rituals? I mean, we have them, I guess, but what do you think?
The fact that almost every culture and religion has them makes you realize how important they are.
Yeah.
They're universally important.
Yeah. So what do you think our culture, I mean, just in the secular world, let's say, what do you think our cultural rituals are?
Wash the body, we prepare a ceremony, we have the family gather together.
Okay. All right.
But I think I know, I'm thinking back to like when my in-laws were children, and you probably relate to this, like in Louisiana, they used to have all-night vigils with the deceased. We've gotten away from that where people, you know, it's become more commercialized and not a ritual,
Yeah.
a cultural ritual.
And it's not done with families anymore. I mean, families aren't the ones doing it for the most part. They're not. You're usually paying someone to prepare the body. You're paying someone to dig the grave. You're paying someone to put the body. You're paying somebody to throw the dirt in on top, right? Right? So it has become commercialized. Yeah. So do you think that changes the ritual?
Oh, yeah, because it takes the personal, to me, it takes the personal spiritual aspect of being there with your loved one and preparing the body for death. Like when my dad passed, you know, we were there to help him to cross over and provide things for him. But even in the hospital setting, and I don't want to take away from the hospital, but if, you know, your patient is there and the family is taken out of the room, and you're not there to help your family cross over.
Yeah. It's often the case. I mean, I think many times in the hospital they try to do that, but it's still not your space.
Right.
I know there's something about it's you know, I mean we try to do that in the hospital, right? We try to make sure that we give them space and room, and we try to make it, you know, make it for him or her who's dying as well as for the family. We try to do that, but it's still not your
Well,
space.
when you got all the buzzers.
Yeah, yeah,
It
yeah.
takes away from, the most spiritual experience I had was helping my dad
Yeah,
to get through that process.
yeah,
It was sad, but it was a
yeah.
spiritual experience.
yeah. Yeah, we you know, I mean, I imagine you can think back to watching people die where it wasn't a good experience. And imagine you can imagine those that were good experiences too. And
It's hard on our children because they don't have an opportunity to observe how the death process works. Generally, kids don't even see most of the process. They just attend a funeral, maybe.
Yeah.
Sometimes they don't. Sometimes they're just told.
Yeah.
Grandma has died. She's gone to another place.
And then sometimes they don't even go to the funeral because they want to protect. You want to protect the kids. All right, I say this. We don't have any priests or pastors in the room, I guess. But I say this to them all the time. You know, for my medical students, I'll ask them, "Hey, how many of you have ever seen a dead body before yesterday? Before you went to the gross anatomy lab?" Only maybe half will raise their hand. And then I say, "How many of you were there with a person as they died?" Even fewer, less than half of that half, right, would raise their hand. And so I tell pastors and priests, oh, this is perfect. Okay, so let me go back. I'm going to think back for a minute about the icons of baptism and the paintings of baptism. There are medieval paintings, and I should have pulled some of these out, in which you're looking at a baptismal font, but you cannot tell whether it's a coffin or the baptismal font. Okay? Because baptism is the symbol of our death, but also our rising anew, okay? Our birth. So I tell pastors and priests that right at the back of the church, right beside the baptismal font, that's where you need to put the hospice beds. Okay? They ought not be cordoned off to the hospital or some other special place. They should be right there in the church, so that your kids are walking by them every Sunday, touching the water of baptism, crossing themselves, and saying hi to Mr. Jones who's dying. So far, no pastors have taken me up on that. But culturally, we don't see death. You know, we push it off to the side. We hide it away. And then we're shocked at it. And so we're not comfortable with it, right? All right. Let's go with one. I think I've got just one more. All right. This one is sometimes called the icon of the resurrection. Technically, it's not. It's called the harrowing of hell, or the harrowing of Hades, okay? And it's actually an icon of Holy Saturday, and not necessarily an icon of the resurrection per se, okay? And the liturgy of Holy Saturday is something that is very important in the celebration of Holy Week for Eastern Orthodox and Byzantine Rite Catholics. Okay, and so this is a very important icon for that purpose. So, talk amongst yourselves briefly. We started late, so we're over a little bit, but talk amongst yourselves briefly about what you see and what you think is going on here. Mind your way. All right. So what do you see here? This is a great icon. This is a great icon. So tell me what you see here.
What is the person at the bottom represent?
This one? Who do you think that is? Nope. Close.
We've got the angels on one side and one side is good, evil, good and bad.
Well, actually, usually that's the case, but these are the prophets and some of the apostles in this instance, okay? And then right here, who's that? No? Anyone? No? Who is this? It's not clear. It's Adam and Eve. And he has grabbed them by the wrist and he's yanking them out of Hades. Okay? All right? So who is it that's bound underneath there? Satan, the evil one. Okay? That's why it's called the harrowing of Hades. Christ enters Hades triumphant, okay, and rips them out of the tomb. Okay? This is a really important icon in Eastern in Eastern Orthodoxy and in Byzantine Catholic circles. So if you have Maronite Catholics or Byzantine Catholics, you can go to their parishes on Holy Saturday, and this will be a very important liturgy. This icon is always at the right inside the altar, usually right behind where the altar sits in Byzantine and Byzantine Catholic churches and in Eastern Orthodox churches, okay? Because it's such an important thing. So essentially, the art of dying well is the art of living well, okay? And the art of living well is learning how to die well. I mean, even Plato said that. He wasn't even Christian, right? And so, rather than waiting until your death to practice the Ars Moriendi, the church has given us the sacraments. The church has given us these rituals and ceremonies that we often don't take advantage of. And they're all in preparation for our death, but they're also at the same time in preparation for our resurrection. Okay? I think that's it. Yeah. Thank you very much. Comments? Questions? Yeah. Yeah.
At the beginning of the lecture, you kept mentioning physician aid in dying.
Yeah.
As something that might be added to a post eventually, and is going to kind of surface for us, not pretty soon, I would think.
I'm afraid many of the states are going to go this way.
But it's so ambiguous. I want physician aid in dying if I'm dying.
Yeah.
I just don't want you to speak it up.
Yeah, well, this is the thing. This is why the euphemism is actually problematic, right? I mean, we used to call it physician-assisted death. They used to call it physician-assisted suicide. Then they didn't like that because they was like, oh, it's not really suicide. Then they call it physician-assisted death, okay? And because that sounds like, oh, the physician is being too active in this, we're going to call it physician aid in dying, medical aid in dying sometimes, okay? And they take over the language of dignity, which people who've been against physician-assisted suicide or physician aid in dying have always drawn on the fact that the dignity of the person is even when they're sitting in their own stool and we have to wipe their bottom, they have dignity, right? That was the language that we used to talk about it. But then they take that language and say, well, this is a dignified way out, and therefore we are upholding dignity as well. So it's kind of Orwellian language games that are being played in that, yeah. And it's kind of, it becomes, it's not just a euphemism, it actually kind of, it makes you think, oh yeah, I want that. It sounds good. Exactly. Yes, ma'am.
Just a comment about who's deciding death, because that becomes a big issue, ethical issue in organ procurement.
Yeah, yeah, absolutely, yeah. Yeah, I've written on that very point in that book. I told John its greatest contribution to medicine is the book I wrote. Its greatest contribution to medicine is the cure for insomnia. So, so if you want to read about that, there you can. Other points, other questions. What's that?
She couldn't see the picture.
Yeah, I'm sorry. I should have made it bigger. Yeah, I should have made it bigger. Yeah.
Is there a reason that what Jesus is saying and when it's shaped like an X?
Yeah, it's like a cross. It's it's the gates of hell have been shattered, okay? And he's using them, it's kind of in that cross-like formation, and he's standing over the chasm now, and he's pulling out the old man of sin and death, Adam and Eve, right? Yeah.
There's 5 states right now that have that law.
Yes. Yes.
Suicide, whatever you want to call it. I mean, there are other initiatives.
Yeah, so other states that have tried it, Massachusetts tried it, but there was such a big outcry from the Catholic community in Boston that a lot of people went out and voted against it. I suspect that the way secularization works is that gradually these things just become commonplace. We get, again, this is the thing about the good things about habits is that they get us into the habit of doing well, right? But they also get us into the habit of doing poorly if they're the wrong habits, right? And so the habits of thinking about death and dying and trying to put it all in individualism and autonomy, right? Which says, I'm an individual. I don't want anybody else wiping my bottom when I'm sick, you know? That individualism kind of then frames the whole thing. So I suspect that the way secularism works is that we tell this story to ourselves enough, and then people begin to believe it. And as they begin to believe it, then more and more states, I fear, are going to make it legal. Now, it's interesting that in the United Kingdom, they've resisted that, and it's one of the most secular places in the world, in the United Kingdom, in Great Britain and Northern Ireland. So they've resisted it, but there are places on the continent in Europe that have taken it on, Belgium and the Netherlands, you know, and they are rampant in favor of it. Highly secularized nations. So I just worry about where we might be headed given the kind of gradual secularization that we see in our country. So.
I have a question. Why did they change the name? Because it is a form of suicide. That's the conflict.
Because they don't want, they want, first of all, you want to say something? Go ahead.
Oh, no, I was just saying, partly, I think I know the answer to this question, which is partly assisted suicide is a Class C felony nationwide.
So in some states it is a felony, and in some states it's not. And the reason it was, do you know why it was a felony? It wasn't because anybody actually believed that this would be a deterrent to killing yourself. Do you know why those laws exist? They exist because it says to people, you are so important to the community that no matter how bad you think you have it, other people will be affected by you taking your life. All right? It's a very communal understanding. So the law is grounded in that. So that's part of it. But the other part of it is that people don't want the stain of suicide. Okay, they don't want that. And then the other thing is they conflate other languages. So in the tradition, and all of our law is built upon this tradition. All law on homicide and murder are built on this tradition. In the tradition, being culpable for someone's murder versus permitting or allowing someone to die are two different kinds of actions. Okay? If I see someone trying to jump off a building and I can't get to them, I'm not culpable, right? I'm not culpable for them throwing themselves off the building, right? However, if I'm there and I, push them or let them go, and I could have prohibited it, then I'm more culpable. So there are degrees of culpability when it comes to homicide and suicide, okay? And the tradition has said no suicide is legitimate because in the body of Christ, you are so important that it has repercussions in the rest of the community, rest of the body, okay? So that's the tradition. And then they start to say, well, there's really no difference if you kill them or allow them to die, okay? And once they do that, then there's no distinction between suicide and homicide. It's not homicide, it's not suicide. It's just physician-assisted death or physician-assisted or physician aid in dying. And so that it deals with another conflation of language about killing and allowing to die, and the distinction that the tradition has made on that. You're not morally culpable if someone is dying of something you cannot prevent. Okay? And you're not going to do anything because so you're not morally culpable in allowing them to die. That is a natural evil, not a moral evil. So all death is evil. It's a natural evil. Whereas if you participate in it, it now not only is a natural evil, it becomes a moral evil because you have participated in it. Okay? And so that language has fallen away, and we no longer think in those terms, except in the way we do our murder laws. So our laws around physician-assisted suicide, physician-assisted death are incongruent with our laws around homicide and right now. Yes?
Do you think that the people that will voluntarily do the death with dignity, it's more of a prideful reason?
Well, I don't want to be a person making those kinds of judgments about it. I mean, there are 7 deadly sins, and I imagine pride is one of the more important ones when it comes to something like suicide. So, yes, ma'am.
I feel like how you were saying, like, taking the words and, like, kind of getting around it. They've also, I feel like they've done that, like, with the actual procedures themselves. Like, it used to be, like, lethal injection, and now they're using sedatives
Yep.
instead. And, like, instead of, like, a nurse actually, like, injecting the patient and watching them die, like, I'll write you the prescription, and you can just go home and
do it.
just
Yeah.
die in your sleep.
Yeah.
So I feel like they're trying to make it, like, less of, like, a direct.
Yeah. Yeah, that's partly why it's done that way, is because they are, but it's going to change. I promise you that there'll soon be laws in various states that will, in the states that already permit it, I promise that it'll eventually get to the point where doctors and nurses are encouraged to be there to give the medication. I am almost 100% sure that will happen, because we like to control things. All right, I've probably bored you enough. Thank you so much.